Hello, everyone, and welcome to our next webinar, our first in our three-part special webinar series with the AlphaZita team. My name is Sarah Holland. I'm very pleased to welcome you, and I'm alongside Dr. Elias Sakos and Gordana Petrovic. Welcome, everybody. Lovely to have you with us. So
Hello.
Hello all.
This special series that we are holding for you is called The Power of a True Holistic Approach to Fertility. And it's something that we are extremely passionate about at AlphaZita. It's what we're all about in bringing a true holistic team together and approach to your fertility, which is very different to what you may think of as a holistic team. I think often people think of holistic as only the natural side, the mind, body, spirit, and they don't always think about it integrating with medical. But of course, we know on a fertility journey that it's extremely important. It's vital to bring together all the pieces of your fertility investigations and treatment to give you the best possible outcome. So in this three-part webinar series, of which this is the first one, we're going to be looking at three different stages of creating your own holistic approach to fertility. The first one today that we're going to be talking about is explore. We'll talk more about what that is in a second, but I'm sure you can guess. The second one, it will be create, and that's about creating a plan that is right for you, that is unique for you, and that will work for you. And the third one, the last part in this series, is all about succeeding and what the results can be if you follow a truly holistic approach to your fertility, and also the question about what success means and how is success important along the way of your fertility journey as well as the final outcome. So we've got lots and lots that we're going to be covering with you, which is why we want to cover this over three parts rather than bombarding you all at once. You know, we want to give you the time and the space to digest this material, to really explore what a holistic approach means for you, and also to meet us, the AlphaZita team, which you can meet us here in these webinars, but also you can come and join us in our private Facebook group as well, the A to Z Fertility Club group, where we'll be sending you links to join us there if you're not there already. But it's an open invitation to come and meet us in the group alongside these webinars so that you can come and ask us questions, talk more about the topics that we're addressing here, because it really is just the beginning, what we're sharing with you, that we can go so much deeper with you. We will also be sharing a wonderful opportunity to come and work with us one-to-one as well in beautiful Greece. So we're going to talk about our fertility retreat as well, and we'd love to invite you to join us there in October. So we have a lot to cover in this relatively short webinar of around 40 minutes. Are we ready to get started, Dr. Sakos and Gordana? Are you ready to share?
Absolutely. Oh, yes, absolutely.
Yeah.
Fantastic. So before we get into what we are going to be talking about, it'd be lovely to hear a short introduction from each of us here. Through these three webinars, you will be meeting the whole AlphaZita team, but we're going to kind of meet you in one at a time so that you get to know the team one by one. I'm really pleased this evening that we're starting this webinar with the two founding members of the AlphaZita team. It's a great privilege to be with both of you, and I know that Dr. Sakos, it was your vision, and Gordana, you had worked together for many, many years, and you created this vision. So it's wonderful to have you both on the first webinar.
Thank you.
So I wonder if Dr. Sakos first, you could do a brief, 1 minute introduction of yourself, and then Gordana, if you could do the same, that would be wonderful.
Of course.
Sure. I think 1 second is enough. I mean, thank you so much for the introduction, and thank you everyone for joining us in the AlphaZita Holistic Fertility team. Well, I can speak about myself that I'm a gynecologist. I'm fully UK trained and certified. I'm a fellow of the Royal College of Obstetricians and Gynecologists of London. And for the last 28 years, I've been working internationally, both in England, Greece, Europe, Cyprus, and so forth, treating international couples wishing to explore fertility. Over the years, obviously, I realized that medicine by itself is not enough, conventional medicine. And luckily, I've met some amazing people like Gordana Petrovic, Sarah Holland, Claire Spink, and Rosie Letts, amongst others. And we managed to create this AlphaZita team in which we holistically approach the fertility issue, and we see the couples, the singles, as a whole. So we treat mind, body, and soul in a holistic way, aiming at providing safety, success, but also integrated care focusing on the individual. Our aim, and my aim as a doctor, but also as part of this team, is not only the success in terms of the pure definition of having a healthy child at home, but also success is defined as a successful outcome, a fulfilling outcome in this unique journey.
Absolutely. You're touching on our third topic there, which, yeah, will be wonderful to get into that when we get to the third webinar, what success truly means, doesn't it? So thank you very much, Dr. Sakos. And I think, as we always say when we hear you speak on this topic, it's so refreshing to have a medical fertility doctor who's so open and really welcoming to the whole picture and all the complementary and natural therapies and the success that brings for our patients. So thank you very much for bringing us all together. Gordana, let's hear from you as well. What do you bring to this team?
Hello, everybody. It's a great pleasure to be here again. I'm really privileged to speak to you all tonight. I am an acupuncturist. I am a traditional Chinese medicine acupuncturist. I trained at University of Westminster a School of Integrated Health a few years back, and where I received both parts of conventional medical training and complementary medicines, specializing in acupuncture. And as the life had it, the fertility patients found me and I found them, and this route sort of became my, so to speak, specialty. It's a great passion of mine to look into fertility issues and helping everybody trying to conceive on their journey. Dr. Sakos so rightly said, emphasized the importance of the treatment of body, mind, and soul, and I couldn't agree more. And that's actually initially what brought us together. And nothing in life is coincidence. It's how we met and how we exchanged our ideas, and we sort of started on this journey, and then joined by all of you. It's a great passion of mine to look into every single aspect that I can for my patients on their fertility journey, all made easier by all of you in the team. Dr. Sakos providing medical a backdrop, which is extremely, extremely important. Emotional, nutritional aspects, massage aspects, every sort of body, mind, and soul work that we can engage in to provide the best care for our patients. So I'm extremely privileged to be part of the AlphaZita team. It's always been my dream to work with like-minded individuals. So great to be here.
Thank you, Gordana, and thank you also for touching on all the different elements that AlphaZita does bring together, which is going to be very clear over this webinar series. Yes, we are a very multidisciplinary team, and it all fits together, doesn't it? Like a wonderful jigsaw puzzle for our
for sure.
patients. So wonderful. So a brief introduction from me as well. I provide the mindset, the emotional support piece of the AlphaZita holistic approach. I work with a technique called EFT, and I'm a fertility EFT coach. EFT stands for Emotional Freedom Techniques. It uses the meridian system, very similar to how Gordana uses the meridian system for acupuncture, but we use it in quite different ways. But yeah, I work with the whole emotional piece. So whether that is purely stress management, or whether it's looking at potential blocks to conception, looking at finding a clear way to make decisions and important decisions along the way, and to feel like you have a clarity of mind, you have resilience, you have connection to your inner strength and your natural optimism when moving forward on your fertility journey, which I think are all extremely important and build a really strong foundation ready for you to then take part in your whole holistic treatment model. So whether that is medical, natural, or more likely a combination of them both, you will have the strength and the mindset to support you in doing that. So I was just like Gordana said, I was very privileged to be invited into this team, and it's a wonderful team to be a part of. So we hope you enjoy stepping into the team with us and learning more about this approach, and seeing whether our approach feels it's like something you'd like to find out more about, and you'd like to be supported by us individually, which we'll be able to offer you more within our fertility retreat coming up in October, which we'll talk about at the end of this webinar. So that's enough about us for now. We want to talk about our topic now, which is a really important topic, and it makes sense that this is the first topic that we are approaching in our 3-part series. And the topic today is explore. So what does this mean? Well, this is the first step, and it should be the first step on any fertility journey, wherever that person or that couple is coming from, whatever their situation and their challenges are. exploring their own unique fertility situation should be the first step. However, it can be kind of the most daunting step as well, I think. It can be where people feel very lost and they're not really sure where to start. And it might start often by looking at their own fertility in a kind of self-guided way. You know, they might start reading lots of books or doing their own research, relying on Google maybe to give them the knowledge and the information that they need about their fertility. And it soon becomes very confusing, very overwhelming, and can lead to poor decisions being made on the next step, which we'll be talking about in webinar number 2. So we see that this explore part is very important. We're talking about investigations, testing, knowledge and learning about your fertility situation from every perspective, from both a natural and a medical, and then how you can deal with those results and what to do if they're different, and how you can integrate the medical and natural approaches. So we have lots that we can talk about here. I'm wondering where to start with this. And I think really looking at this step of explore, you know, why is that important when creating a holistic fertility plan? And I know we'll all have different perspectives on this that complement each other. And we'll probably each give our own answer here. But Dr. Sakos, perhaps you could share with us how you see fertility investigations helping you decide with your patients about, you know, what step is next for them. What does this step mean for you?
Sure. I think it's very important from the medical point of view to assess the couple. And this can be very clear and can be very quick. The assessment could be either verbal, on the phone, on Skype, or in writing, digital. It doesn't have to be with the traditional kind of consultation type, sitting with a patient and all that. So as far as we're concerned, you know, over the years we have developed a very short questionnaire. It's only 2 sides of an A4 paper, in which we can explore and get a rough idea of what's going on. So, you know, by just checking the ages of the couple, the female age, the male age, the duration of fertility, the type of infertility, if it's primary or secondary, simple things like how long the periods are, the duration of the mid-cycle bleeding, if there's any, or the duration of the period itself, plus some very simple questions with regards to the possibility of hormonal tests that may have been performed, tubal assessment and semen assessment. So within less than 5 or 10 minutes, someone can fill in a questionnaire, and the fertility specialist can assess and give an overall impression of the fertility of that couple, the fertility potential. I think this is very important because this is laying the foundations on which the rest of the management can be built on. And that includes both medical management and holistic management. Of course, assessment from your point of view of stress levels, of diet, of nutrition, of mindset is also very important. But for example, you know, if there's a couple with where, you know, the lady is 45 years old with blocked tubes, it's very important for them to realize that it is almost impossible that the conception could be natural without IVF, for example. So, in my opinion, a very quick fertility assessment from the medical point of view is absolutely vital in order for the holistic additional approach and the natural boosting of fertility and stress management is concerned in order to be built on successfully, and also in order to have the specific focus. So I think the medical assessment, and this is quite unique in our group, I believe, is that this is laying the foundations on which then the natural approaches and the complementary approaches can be more effective.
That's so true, isn't it? And I think all of us will have come across situations, I know I have, when someone has not gone through that thorough medical testing or knowledge at the start, and they have gone down a certain route, and like you say, have found out later that they had blocked tubes, or found out that there was a 0 sperm count or something else that was really preventing natural conception. So it wouldn't have mattered what natural treatments they had in place. That information needed to be known at the outset. So it is important to get these steps in the right order, isn't it? So yeah.
Sure. And if I can just add this, and also from the medical point of view, I think it's very important to put a perspective. So I think the couples, within that assessment, within that 20-minute consultation, they need to understand what are the choices and what are the options and what are the percentages. So, for example, if we have a couple in the early 30s, where the basic investigation is normal, with normal hormones, normal scan, normal sperm, and normal tubes, then of course the focus should be the natural boosting of their fertility. So that couple would greatly benefit with our blessings, if you like, and with our stimulation and support and encouragement to explore the natural conception options. And of course, the role of the team then is moved on to the natural ways of boosting their own fertility. If we have a couple in their late 30s with, for example, polycystic ovaries, then again, from the medical point of view, we stress the importance of nutrition and diet and stress management and so forth. So I think from our point of view, it's very important to focus on the potential issue, potential challenge, and then direct the couple accordingly. On the other hand, if we have a couple in their mid-40s where the quality of the eggs is diminishing, the cycles are getting more irregular and all that, then again that could give them a specific perspective as to what they should be looking at and what the options are. So I think from every point of view, it is very important that we do get the initial assessment so that the couple can have, if you like, the scientific and the evidence-based umbrella and the direction of what is important for their individual circumstances.
Absolutely. Knowledge is power, isn't it, at the end of the day? And, it's not wanting to waste time or money on some routes that may not be successful. And especially, as you said, though, medical treatment may not be needed, and then you can focus more on the natural side. So it's really good to know that from the outset. Gordana, is there anything you would like to add there from your perspective, from a Chinese medicine perspective, and how you work with your patients from that stage?
For sure. As what's just strikes me, what Dr. Tsakos just mentioned is basically, yes, there is a 20-minute assessment and it's a simple format, which is brilliant. But I mean, how great that is that even the medical treatment is individualized. So at a certain age group, you have a certain potential problems, and you have to focus on those, and then not leaving any gaps in that sort of age group. Then build up on that, then advise. So even how great it is that medical aspect can be individualized. It always impressed me about how we do things and how our medical team deals with that. It just came very prominently to me. Leading on to my individualized kind of assessment, my assessments are much longer, I'm afraid. The first assessment is just sort of looks in everybody's life with a magnifying glass. So from everything, the sleep and the diet and the dreams and the emotional reaction to stress, to headaches, to all sorts of whatever is there to mention. I mean, sometimes questions are even surprising. They sort of the patients can't see how that may be linked, but that is very easily explained. So the consultation is quite extensive. I do some parts of my consultations online as well. I can do them on Skype and initially give information on the phone as well. But big part of my work is observation. Chinese medicine is based, and the diagnosis by Chinese medicine postulates is based on observation. And by that, I mean, I look at a patient as they walk in. What's their stance, how they look like, the color of their skin, the sound of their voice, the way they're sitting, the way they are moving, the way they're gesticulating, what they're saying, and especially what they're not saying. So reading in between the lines, not projecting, but reading what's not being said, especially initially, it can be a little bit difficult to open up everything, and I'm always very careful not to thread or to thread very lightly, to establish the trust and understanding of the medicine, how it works and why it might be beneficial to them. Big part of my diagnosis as an acupuncturist is observation of the pulse. So there are 9 different pulses on each wrist, which we take not just for the speed, but for the qualities, and then observation of the tongue. And then once the patient is down on the bed, is the abdominal examination as well, meaning palpation of the abdomen and looking for certain channel reactive points. So my first assessment and treatment frequently runs over an hour, and then based on that we are able to talk about a plan for the future. But what is for me quite remarkable, and again I can't stress enough how privileged I am to work with all of you, is that I always have someone to talk to and to consult, obviously, without divulging any details of names or anything, but just having an understanding of the case that I can discuss with the team. This comes especially when there are medical results presented that I need to understand. I can by now understand most of them, but some of the readings may be quite specific, and knowing that I can always contact my medical team for advice and sort of guidance is invaluable. It's invaluable because I see patients both of natural conception route and as a support to IVF, and it's very extremely important to be versed in medical conditions and in the solutions and the most advanced techniques that are present and that are used, and also the studies that have come to confirm efficacy of certain methods. So for me, this combination is absolutely invaluable, even in natural conception terms, because I'm a big believer in good investigation to prevent going a wrong route or wasting time on a route which is not going to produce the results and which is going to make this journey more excruciating. So again, both with the individual approach to every group, age group of patients, and combination with the medical doctors, and with all of you covering different aspects which I might have just elements of, is really what makes the difference. This is why we are also happy to work together.
Yeah, so. It's so important, isn't it? Because, if someone wants to go out and try and build their own team, and they have their doctor at the clinic, and then they go and find an acupuncturist, and then they go and find someone for the emotional support or the nutrition, they're bringing it together, but that team maybe have never met each other. They don't work together. They might have very different perspectives around fertility as well. Obviously, we have the medical doctors who may not be very open to the natural side, and then you have the natural practitioners who aren't as well versed as you are and the rest of us are in the medical side. So it can feel very kind of separated, can't it, and not at all integrated, and can feel quite tricky and difficult to manage for the patient. So I think that's a really important thing to remember, that when you are building your own approach and your own team, it's wonderful if it can be truly integrated, which of course we are, because we all work together, we know each other, we respect each other's approaches, and we understand them. Something else that really struck me from what you said there as well, Gordana, is kind of how different your assessment is from Dr. Sakos. So we each have that different step, don't we, that we apply in our own unique way, and we're looking at the same patient, the same fertility status, but looking at it in a different way and shining a light on it in a different way. So starting to build that real picture. I've had Chinese diagnosis myself, and it is fascinating, the kind of questions that you're asked that seem relatively random, but then when they give you, you're given that overall picture, it's really interesting, and then it does shape the treatment that you have afterwards, which we'll talk more about in the next webinar. But from my perspective, I kind of could relate to what you were saying there, Gordana, because in my perspective, I want to I want to hear what their experience is, you know, and how they are feeling and what they're experiencing on their fertility journey this far. So I will talk to them, and I'll listen to how they talk about their fertility and their challenges and their decisions they have to make, and the past and the future and the present and everything that they're dealing with. And as we talk about the prospect of them becoming pregnant and giving birth and being a parent, also seeing how that feels to them, just to explore that step that they're looking into approaching. So, and yeah, looking for those clues and where the fears might come up, or where something feels blocked or difficult to think about. It's really interesting to observe and to have that dialogue going. So yeah, my assessment isn't as kind of rigid as a form filling. It's more of an exploration with them, and it continues through the sessions that I have with the people that I work with. So, but I see that the mindset part, and we'll talk more about this in the next stage as well, but it's all about really reducing stress and worry at this initial step, you know, this step of exploration where they are committing their time and their trust in going through this process of tests and investigations. And if they can do that free of stress and worry and without feeling overwhelmed, then they're more likely to be able to make good decisions as they move forward and, you know, be fully engaged with the process. So we can see how they all kind of interrelate with each other. Now, we touched on it, especially Gordana, you were talking about working as a team, but I think people often think that when they're trying to combine medical and natural practitioners and approaches together, and especially just at this first stage, you know, of having all your conventional medical tests, blood tests, scans and so on, and then having a Chinese medicine diagnosis alongside the nutritional profiling and everything else, you know, how does that really work? Can you come up with different results? Do they differ? Do they clash in some way? I mean, I'd love to hear your perspectives, because, you know, you have worked together for a long time, and how that information can be used together. Or are there any challenges? You know, how does that work, Dr. Sakos?
Well, it works. I mean, there's a fancy word for it. It's synergistically. So it's you know, it's a beautiful combination, because it's looking at the same image from a different angle. So all you can do by doing this is you explore all the areas that might be hiding if you just have one viewpoint. So I can only say that this is an amazing approach. It's a 360-degree approach, and this may make all the difference, because you know, let's take again a hypothetical couple in their early 30s who, I mean, I don't want to oversimplify the medical approach, but I think that people have to realize that, you know, they shouldn't be afraid of the medical approach. They shouldn't be overwhelmed by long lists of iffy investigations and terribly expensive rare conditions and situations that they may need to explore in an initial visit. So although I wouldn't like to oversimplify, I can say that, you know, there's only 4 or 5 factors that may be implemented really from the medical point of view, especially in the initial phase. Of course, you know, not all couples are straightforward, but the majority, they would just need a very simple medical investigation. So once this is done, then I think it's quite relieving for many of our patients to realize that, you know, if they improve a little bit here and a little bit there, 5 or 10%, you know, can make a lot of difference. So my overall feeling is that this works synergistically. This works in a nice and controlled and cooperative way, and this can only have a benefit, and that benefit could be physical, it could be emotional, and of course spiritual, and that would fortify the patients with all the powers they need in order to keep going with the journey, because as we all know, it's a matter of persistence, it's a matter of perseverance, and it's a matter of having a realistic expectation. And I think as a team, we can work towards that. And the patients realize that, whether they're couples or singles, they do realize that we can support that realistic expectation, and we can empower them to achieve that.
Mm. I love that. You know, that's why we're here, isn't it? That is what we truly believe in. And I love that image of shining a light on the hidden areas as well. It's almost like if you just go down one route to testing and investigation, you're only seeing one side, aren't you? And you're just, you know, looking at one area potentially, and you might hit the jackpot, and that was the one that needed to be looked at, but it's taking a bit of a chance. So yeah, if we can do this multidisciplinary approach and looking at all the different areas, even the ones that you think might not be needed, but do it in a kind of clean and concise way. Like you say, it doesn't have to be overwhelming. You know, if you have the right team on your side, it can be done in a relatively quick and straightforward way, taking the mystery away, isn't it? You know, of wondering, what do all those different medical tests mean? How can I approach a Chinese diagnosis? What do I need to look at with the nutrition side? You know, it can feel very overwhelming to the lay person who isn't medically minded, doesn't know much about fertility, just that they're experiencing challenges themselves. So it's lovely to have all that pressure off, isn't it? And have it simplified and straightforward, and get your information quickly, so that then you know how to act and what to do next. Gordana, I'm interested to know as well, because I know you have many years experience in the world of fertility, and something that people listening to this may have come across is challenges as well in sharing information, you know, challenges with working with an acupuncturist and also trying to go ahead with IVF and not having the two integrated, for example. You know, have you come across any challenges in the past when teams aren't working together?
Yes, I did. I'm lucky I'm not part of that team, and I'm part of this team where things are working. We found each other, you know, but no coincidence. But yeah, we work very hard together to bring the best for our patients. I think it's all about the balance, you know, like in life, and it's on a fertility journey as well. It is about the balanced approach, and it's not so easy to achieve. And partially it's because people are not aware of the importance of the balanced approach, and they are not even aware that there is a balanced approach, what it is. So actually, but I have to say, once you present it in a coherent and clear way, everybody understands, and instantly they get a connection to this kind of route. I worked with different medical teams, and yes, I mean, you do sort of work together and sort of see each other and see the notes of the patients, but it hasn't worked that well, because primarily because of lack of time, lack of time to coordinate, to look into the cases, and partially because of the lack of interest in some cases. So it just depends, I suppose, how people understand the integrated approach as well, both, as you said, the conventional medical field and us as complementary therapists, because I do know several colleagues that do not want to work within the field, and that's a personal decision. You know, obviously, people can go their own way, but I've always believed that not one person can know everything, and you can learn from everybody.
There's always more to learn.
That you meet. There is more to learn, and we should be open more to learning, not because we gain the knowledge, so we get this knowledge and then we are very knowledgeable and we are very respectable and whatever. It's because of the benefit to the patient, only and solely because of the benefit to the patient. It's our responsibility to put the patient right into the center and do whatever we can. Gear up with the team, look things up, work things out, give them the best. This is 100% commitment that I'm talking about, and no less will do. Not in my case, and I know not in the case of my team. And this is why it works so well, because everybody brings in 100%. And as Dr. Saka said, it's the synergy of the situation that works, and we are looking at the same patient from a different angle. Simply because we cannot all have 360-degree, as you said, Dr. Saka's view, because it's you know, and obviously everybody brings their own experience in the therapy and in life, and that all works beautifully together. And yes, there can be challenges, but I can really, working with you as a team, can just see the benefits.
I think
that's far.
you just highlighted for me the difference between, in my own personal experience as well, because I've been a fertility patient myself, the experience of the difference when you put the patient at the center. And when you said that, putting the patient at the center, not
Always.
your treatment at the center,
No.
or your one approach at the center. And I know my own experience of going down the NHS route of fertility investigations was that I was just automatically offered to be put onto the waiting list for IVF. When I was already working with some natural practitioners, I had some insight into what my fertility challenges were. And it was, well, we don't do that here. It's IVF only. So, it wasn't me put at the center of that journey. It was the one treatment that was on offer. So I think it does make a difference, doesn't it, to work with a team rather than, kind of broken parts of an approach, all trying to fit them together, but they often don't. So it's,
yes,
it's a different.
This is it really. I mean, it all really starts and ends with the patient. Obviously, we would do, but if this is not the center of our attention, and if this is not a goal, then sooner or later there will be holes. Sooner or later things would be different. You have to. I mean, I have to really always have this person in mind. This is my focus, one and only focus. And then from there on, the focusing on the patient is actually going to lead you into working out your own treatment strategy. You're developing your observational skills, going into detail, working out what this person really is and how to get to them. Because not everybody would be open to talk, or they would talk a lot and say nothing. And you get nothing. You just get waffle half the way because people are nervous, or this is their usual way of communicating it. And then it's my responsibility to get out of them other things as well. Not what I think it might be in their head. It's not about that. It's just seeing whether there is anything in there more and how we can be more practical about things. But that can only happen, in my opinion, if the patient is your center and one and only focus. What is the good thing for this journey for this person? And if the acupuncture is something which is not going to work, Dr. Tsakos was saying rightly just before, if you've had a 45-year-old couple with limited ovarian reserve or no reserve, and if the tubes are blocked, I have to be really realistic and inform them to what extent I can work. I can relieve the pressure and of the stress of them knowing that this is happening, but there is a limitation to my therapy, and then I know what to do. Or if there is, an extreme digestive issue impacting something, I am gonna have to speak to Rosie immediately and transfer, because I could do it from my limited little knowledge about that. I mean, it's quite a bit of knowledge, but it might not be appropriate, and it's quicker to get this patient through Rosie than with me playing a therapist who can be holistic and do the whole thing,
Yeah. And that's why we are so passionate and dedicating a whole webinar today on this explore topic, because we need that information. Everyone needs that information, most of all the patient who is at the center of this. And I think as we go ahead now on the next two webinars, and we talk about creating that plan and the success that we're hoping to lead our patients to along the way, as well as the final outcome, that it will be clear that we always are putting the patient at the center and how important that is. So thank you for sharing. That's been really interesting to hear the perspectives. And I know that, this theory of putting the patient at the center isn't just a theory. It's something that we do in practice, and it's something that we do in many different ways. None so much as our retreat that's coming up in October. So I'm really looking forward to that. It's our third AlphaZita Fertility Retreat happening this October, the 10th to the 13th, over the weekend. And it is that real opportunity, isn't it, to leave everything else behind, to jump on that plane, to go to a beautiful location in mainland Greece, in Halkidiki, and be pampered and looked after, and have that experience of being in the center of all our care and attention and focus, and being able to meet the whole team, being able to work with each of us individually, and really give yourself that time that time and space to explore your own fertility situation, to start making progress towards having treatments and advice, and you know, making those really positive steps towards having your baby and creating your family. So we know already what an amazing experience it is to take part in the AlphaZita fertility retreat in Sani Resort, which is a beautiful 5-star resort in Halkidiki, and we are now open to registrations. We only have, I believe it's space for 6 couples, so it's a limited number of availability because we like to keep it intimate so that we can work with you all one-to-one. But it is, yeah, it's a wonderful experience, isn't it? I wonder if Dr. Sakos and Gordana, whoever would like to start, is there anything you'd like to share about this amazing retreat experience so that people can understand it a little bit more?
Sure. I mean, I think it's a pretty unique concept. Mr. Dave Gibbon, an embryologist, defined it as a blueprint in fertility care, management, and approach. I do think it's quite unique. I haven't seen anything similar in the world so far. There's bound to be some followers. I hope there will be, and I hope we will have the time and the opportunity to interact with these people and build an even better service. I think it's pretty unique because you see some amazing people. I mean, from the patient's perspective, the feedback we got from patients from all over the world, from the UK, from Europe, from the US, who joined our retreats in the past, is that they had this amazing opportunity to meet the fertility specialists, the conventional and complementary fertility specialists in a relaxed environment. They had the time to have one-to-one care, one-to-one consultations, repeat consultations, discussions. They made friends. They made connections for the rest of their lives. And with regards to the impact that the retreat and the coaching, the one-to-one coaching they had, the feedback we got, as you all know very well, was that they had impact for the rest of their lives, not just for the fertility issue, but for the managing of their personalities, their health, their well-being, and so forth. So it's an open invitation to the lucky couples who will make it to this retreat. I don't think we should be able to keep having more than 6 people, as you said, but that is going to give us the opportunity to interact. We're very grateful to the people who attend because we have the opportunity to get feedback from them as to how we should be approaching couples, patients, singles in their unique situations. So for us, it's a very, very unique and training experience as well, whilst we interact with ourselves, with the team, within the team, and also with the patients. So I'm looking forward to that. It's an amazing opportunity for myself as well, for my own personal development.
Wonderful. Gordana, do you have anything you'd like to add about the retreat experience?
When is the October coming then? A few more months. As soon as possible. Yeah, it's a terrific experience. Yes, we've done 2 before this one, and well, yeah, I mean, how much better can it be than Halkidiki in Greece, really? And then Sani Resort. I mean, if you have a look and if you Google it, yeah, you'll be stunned, that's for sure. But that aside, you know, the Greek hospitality and the climate and the setup, yes, all important. But the most important time in your life is in a patient's life is coming when they're planning the family, and this time should be set aside for just doing your own thing for your fertility. I find it here, you know, people are overwhelmed. They're overwhelmed with work, overwhelmed with traveling, commuting, family responsibilities, and, you know, so many other things, their careers, and sort of extracting oneself from that and setting time to look after one another as a couple, look after oneself, sort of interact with other like-minded people, and have one-to-one attention and therapies that would be beneficial to the fertility journey of each one of them is incredibly important. I can't stress enough. It's just this fact that you need some time, you need some a different setup, a different backdrop, and not to mention all the therapies, all the interactions with like you know, people on the same journey with therapists is very, very important, if at all this is possible, to take time away and focus on this one part of the most important time in our lives if we want to start a family. So again, I'm again about this patient-centered thing. So patients themselves should be putting themselves in the center of the happenings and what is
and you're right, Gordana,
what is being
putting yourself at the center and actually giving yourself the gift of that time, the space, the attention, the support. It's a magical combination, isn't it? So, and
absolutely,
not everybody can come because we don't have the space, but for 6 individuals or couples who want to come along, it's going to be a wonderful experience. It's where the magic's going to happen, I'm sure. So
it will. It definitely will. We are looking forward to spreading some magic for sure.
Brilliant. So we're open for bookings now. You can find all the information on our website. If you go to alphazita.com/autumn-2019, and we'll also put a link here next to the webinar, you'll be able to click through, read all about everything that the retreat offers you, the wonderful accommodation and the catering and the beautiful surroundings, as well as all the one-to-one support and the guidance that you're going to get from us as a team. So everything is on the site there. If you have any questions though, if you want to have a conversation first, and I totally understand if you do, because this is perhaps a different approach that you'd be taking, and it's a commitment to taking some time off and flying to Greece, we'd love to have a chat with you. So just send us an email to info@alphazita.com. info@alphazita.com. We'll also put the link there for you to arrange that chat with us. But just send an email and say you'd like to have a talk about the retreat. We'll get on the phone or on Skype or on Zoom with you and have a chat through exactly what this retreat involves, talk to you about your own situation, see if we feel it is suitable for you. But it is open to absolutely anybody on a fertility journey, whatever that looks like, whether you are on a journey alone or in a couple, whatever stage you're at, whether you're having treatment or not, whether it's primary or secondary infertility, and even during pregnancy as well, after fertility issues. You are very, very welcome to join us. So it's truly, as we said, a truly holistic approach to you and also your fertility. As Dr. Sakos said, the benefits to investing in an experience like this is going to be lifelong. It's not just about those few days that you spend with us, it's about the rest of your life and obviously into pregnancy and parenthood as well. So we hope that you would love to join us. We'd very much love to welcome you there. So I think we've covered everything we wanted to, or we can, in this time, but we'd love to continue this conversation with you about a truly holistic approach to fertility over in our private Facebook group. That's the A to Z Fertility Club. So do come over there as well. All us 3 and the rest of the team are there in the group to answer your questions, to continue this conversation and to continue supporting you. We'd love to see you at the next 2 webinars as well. So look out for those. And thank you very much for joining us. Thank you, everybody.
Thank you, Sarah.
Thank you.
Take care.
Thank you.
Bye-bye.
Bye.
Goodbye.
Bye.